like you to think, uh-oh, we're recording it. Pressure just escalated. All right, so if you could think about the activities that you enjoy. What kind of activities do you enjoy? Why are they enjoyable? I'm curious if we could get a few volunteers to offer up answers to those two questions. What do you enjoy in life, and why is that important to you?
I think maybe we can use the chat box too, if that's all right.
Yeah, absolutely. If you don't want to unmute, but feel free to jump in. I'd ask if you could do the chat box management, if you could, please.
Absolutely.
Well, I'll start because I'm brave. I'm the presenter. I really enjoy music. I play music pretty much every day, and it's kind of my point of focus and the place where I get to go and calm my thoughts if they're out of control. I also really enjoy playing for people, and that gives me pleasure, and it's a socialization thing as well. But yeah, music.
We've got singing with groups of people because it brings joy. Shauna says dancing. Ginger Weber says pickleball. Art, playing music, going for walks, music, dancing, sports, socializing, and meeting new people. Lots of answers. Thank you.
Yeah, thank you very much for your answers. And you can see sort of a thread in there. But ultimately, the benefits of activities are similar for all people, and they are especially important for those with dementia. Some of those benefits can include improved ability to think clearly, learn and remember, improved emotional well-being, decreased isolation, increased independence, increased self-worth and esteem, improved physical health and boosted immune system, and increased longevity and quality of life. So yes, activities are important, and we know that. The purpose of this presentation is to help you to facilitate enjoyable and meaningful activities for people with cognitive deficits. And at the end of this presentation, hopefully you should be able to understand what kind of skills and approaches are needed in leading activities. How do we offer activities to people with differing and changing needs? And then lastly, some tips, ideas, and best practices for activities. So let's talk about activities leaders. What skills are important to be able to lead activities, especially for people with dementia? The activity leader will have the best chance of success if they have some key skills and personality traits. First amongst them is to be open-minded. Being open-minded allows you to gain insight, challenge your existing beliefs, and considering new ideas can give you a fresh insights into the world and also teach you new things. It's important to be creative when you're trying to find solutions to a problem. Thinking creatively opens the possibilities. You look at the situation from different angles. Often people get stuck on solutions that they always used in the past. While it might still get the job done, it could be done better if it was more creative. And that's how we get unique ideas and how innovators set themselves apart. It's important, although it's not vital. Obviously, experience is crucial. And being experienced allows you to build relationships more easily. That experience teaches you how to deal with different types of people. And as you gain experience, you will learn how to handle different personality and differing needs. Doesn't mean if you don't have any experience, you can't do this, but you'll get better as you do it more, obviously. It's important to be kind. Kindness leads to many good things like better relationships, improved self-esteem, compassion, happiness, future success, and good mental and physical health. Being nice to others can also be one of the easiest and quickest, most inexpensive ways to keep anxiety at bay. It calms the mood and takes the focus off yourself. If you are being kind to someone, you are most likely causing them to smile. And if you see that smile for yourself, it might be catchy. Studies have shown that seeing someone else smile or show an emotion automatically activates that same area of the brain as if we experience that emotion for ourselves. And this could range from smiling at someone or giving them a compliment. And kindness truly is contagious. Lastly, it's important to be patient. The power we get from practicing patience isn't just something that allows us to get through our day without yelling at the people who annoy us. It lets us have control over our emotions. Being patient allows you to be in charge of your actions and reactions, which is something vital when helping people with dementia. When we're patient, we turn problems into opportunities for growth and change, and instead of getting frustrated and ruining a situation because it didn't work out how we intended, patience allows us to calmly deal with the obstacle and come up with a solution that will allow us to move forward. I'm curious, what other skills do you think are important to be able to work with people and provide activities to people with dementia? And again, please unmute yourself, or you can put your answers in the chat box.
Somebody wrote, Shauna says safety, and I'm thinking an ability to let go of your ego sometimes.
But what do you mean by that?
Because you said specifically with people with dementia, and oftentimes there's challenging behaviors involved, and so being able to not take things personally is really important. Flexibility, yeah, good listening skills. Caitlin said flexibility, and Lindsay says good listening skills. Caroline says enjoying learning, a sense of humor, understanding. Lots of good answers.
Those are great answers. Out of those, listening skills strikes me, and I think it's a lot of times the folks, especially the moderate to advanced dementia, it's not the words that they're saying either. It's really the nonverbal cues that super crucial to listen for. And so I appreciate those things. Safety is super important. Flexibility, we'll talk about a little bit more, and how, you know, instead of approaching activities from an objective based perspective where like there's winners and losers, or there's a score, you know, flexibility built into activities for folks with cognitive deficits is really kind of like going with the flow. Bingo could turn into a coloring activity, or, you know, I'm sure there's some stories, and hopefully there'll be some folks that can share activities that just didn't go as planned but still went really well. But we're going to get back to some skills with activities leaders. Again, thank you for your examples. I think all of those are important skills. In my experience, the two most crucial skills in leading activities are the ability to engage and motivate people, though. And so we're going to talk about those two concepts. You know, there's the motivation part. Often we find that finding activities suitable for a senior comes with relative ease, while motivating them to participate can be the bigger challenge. There can be lots of barriers, real and imaginary, to participate in activities, but with proper motivation, we can overcome most of the reasons that make people feel like they can't participate. But before we can really motivate somebody, first, we must be able to engage with them. We have to have a relationship to be able to draw upon. And so, you know, essentially, engagement is interaction. How do we get to know somebody? How do we form relationships? How do we foster socialization and interactions? And all of these things are important to engagement. Amongst engagement, our ability to have small talk is probably the most vital. And talking to senior adults on a day-to-day basis allows you to determine how they're doing health-wise and their state of mind. Small talk fosters communication and interaction and allows you to learn about their interests and passions. It's good to find out what is going on in their lives and to learn about their habits and daily routines. All this information is crucial to offer activities that people will enjoy. So if small talk is so important, you know, how do we engage in small talk? And small talk doesn't come easy for everyone. So it's I think it's important. By having a handful of questions prepared and ready to use, you can glean all sorts of important information about people, their life story, their preference, their current emotional and cognitive state, and other details that allow you to get to know someone. Again, not all of us are extroverts, but if we're in this position to support folks with cognitive disability, it's up to us to be able to come out of our own shell to get them to come out of their shell. And so, keep these questions in your back pocket. Super easy stuff like, how are you feeling? What are the doctors saying about your health? Do you have any personal interests? What does your typical day involve? Are there any events that create excitement for you, and has anything changed in your life? I'm curious, is there any other examples of kind of small talk questions or icebreakers that folks like to use? And put them in the chat. Please unmute. You're on mute, Andrea.
One of the answers we've got is, where did you grow up? It tells me a bit about their cognition also.
Right. Any other ones? We can move along. So yeah, small talk. Practice it every day is an opportunity to practice your small talk with somebody. And when you're talking with someone who has cognitive deficits, try to use the following communication techniques. It's important to be focused on your breathing. If you feel like it's going sideways, take a few deep breaths, stay positive, smile, and remain still throughout the conversation. Remember how important it is to practice patience. Pick a topic, bring in conversations that will appeal to that person, their area of interest. Avoid irritating and angering issues. Stay away from any triggers, whether it's topical or environmental. Get close, avoid talking down to them. Sit close to the senior residents during conversation. Get to their eye level. If allowed, soft touches to the hand, arm, or shoulder can help create a feeling of closeness and warmth. It's good to be mindful of people's space too. You're going to know when somebody doesn't want you touching them. And please be respectful of that. Listen, avoid asking questions or correcting them. It could be confusing. Use your listening skills instead. And pay attention. Keeping them focused is paying attention to what they are saying. Give eye contact and show that you are engaged. So verbal and nonverbal communication is super crucial to somebody who has a tendency to be confused about things. So once you're able to engage someone, to get them to come out of their shell and to participate, motivation is crucial to be able to increase their activity. Often as people get older, it's not uncommon to notice that they've developed some feelings of indifference towards their normal activities. Daily activities may become more difficult for them to perform over time, which may leave them feeling less energized or depressed. Although they may require some motivation to stay involved, it is important to find positivity in any attempts and encourage them to keep active. Do not be put off if you initially run into some hurdles when attempting to motivate someone. We all dislike seeing people we care about feeling discouraged, and you can offer some simple solutions to conquer that self-doubt and overcome these potential barriers. So let's talk about some potential barriers. If you work with people of a certain age, you might hear these things more often. So
David, we have a question.
Oh, sure. Thank you for your interruptions.
Yeah, so Caroline has a question. So go ahead, if you want to go ahead and ask it.
Sure. I have a question regarding what you do about engagement with people with dementia who cannot engage in small talk. Who can't really understand words very well, and who absolutely do not like you to ask them questions because it shows that they can't understand the words.
So I'll share with you some of my perspectives, and I'd love for the group to also share theirs. And it's a great question. Thank you, Caroline. For somebody who is generally nonverbal, at first I would not automatically assume that doesn't mean that they're not hearing and comprehending what you're saying. And so looking for nonverbal cues of being able to answer yes or no is crucial. Also, we've seen people sort of wax and wane on their capability of speaking. So sometimes they speak a little bit more clearly in the morning or in the afternoon. They're not as capable. But you're describing somebody who we know just does not want to engage in any sort of questions, and that's also common. So let's do the literature would say focus on sensory or other type of nonverbal communications through pictures is the first thing that come to mind. So, but ultimately, when somebody gets to that state of cognition, it's important to understand what is their soothing devices. A lot of times it is sensory devices, something they can pet or something feels good. Sometimes it's them being pet on the hand or something that allows them to be soothed. Sometimes people can communicate through pictures though, so they'll point to something versus being able to verbally articulate. That's just some stuff that I can offer. I'm curious, there's a lot of people on the call that might have something better to offer or something else.
And Lindsay wrote, singing is great, often is preserved beyond the ability to talk, which kind of really seems to go along with what you were saying, David. Yeah, definitely music is a big one. We use a lot in our day centers.
Any other ideas? That's a great one.
Bart says agreed, old-timey songs.
Okay, well, thank you for that question. If there's any other answers or you think of something, please put it in the chat box. So let's continue with motivation. And these are barriers that we're trying to overcome. So somebody that speaks to or shows a lack of interest or energy, have an open conversation to see what interests they have, encourage them to participate in developing a plan and take small steps towards those interests, and continue to emphasize the benefits of why they're doing it in the first place. I see Bart and Rhonda on this call, and the essence of a physical therapist, he just spoke to this last week, is to essentially like coerce people to do exercises that they don't really want to do. And I don't want to like I don't want to put you on the spot, Bart, but I know that I've seen you do this really well. So how are you encouraging people to motivate when they're not inclined to maybe do the exercises that are good for them? Now you're on mute, Andrea.
I thought I unmuted myself. Rhonda says, make it fun.
The gamification and
it looks like Bart's trying to talk, but no, we can't hear you. You are muted. Let me see. If you give me just a second, we'll try to. Where is he? No, we can't hear you, but you're not muted. He says, I've been talking and making great jokes.
I don't doubt it. Well, let's talk about that concept of fun and gamification, and maybe we can get the audio to work. But yeah, first thing I think of is when I'm trying to do a task, you know, how do I make this fun? How do I put a scoreboard to it? That's me. I'm competitive. What does that mean for that person that you're trying to do the stretches or the chair yoga? And each person has different motivations, and sort of a reward system is really what we're looking for, but also how do we have fun along the way? I know there's a lot of dance-oriented exercises in our gym, a lot of music-oriented, rhythm-based exercises, and those things really engage our folks. So if we're ever able to figure out audio for Bart, love to hear his perspective. But let's move on to
He did add a few more things.
Oh, go for it.
But really kind of echoing what you're saying right now, that you have to trick them into exercising by dancing, using music, introducing simple moves, starting with a foot tap. And then we've got Bruce, who said, I used to work with a 94-year-old man with Alzheimer's. I would bring my laptop and put on YouTube videos of big band music, Sinatra, Ella, etc., which I love anyway. He was also into Einstein, so we watched documentaries about him. Videos were great for his enjoyment and for our relationship.
Wonderful example of using multimedia opportunities like YouTube, laptops. There's such a vast amount of resources out there, but key thing I've heard in all of that is getting to know the preference of the person. Because putting on, you know, Metallica's Ride the Lightning probably wouldn't have gotten the same response as like the other music that was mentioned. So be mindful about preferences. I like Ride the Lightning, but I don't know how popular it'd be here in the day center.
Shauna also commented and says emphasizing their strengths.
That's a wonderful concept, and I think we'll talk about that a little bit more. So pain and discomfort, this is a reality. Some of us right now, including me, right, are dealing with chronic pain issues that get in the way of quality of life. So how do we deal with that? Hopefully they can speak with a healthcare provider to assess the source of pain and hopefully reduce it. They can also understand what activities can be done safely without aggravating the injury. So it's important, if there is a pain as part of the issue, that to understand what that is so that we can hopefully address it, as well as to make sure we don't aggravate it. Also, in some cases, depending on the importance of the activity, we might want to discuss pre-activity medication. You know, taking ibuprofen before exercise, for example, is something that some people do. But yeah, pain and discomfort, definitely a barrier.
Can you hear me now?
Hey, I can hear you.
All the things, first of all, Ride the Lightning is awesome.
Thank you.
But so, yeah, as I was trying to lay out quickly, now that I'm a bit late, just to get their foot tapping and get them engaged in the music, and even thinking and talking about what they were doing when, you know, Dream a Little Dream of Me, or not Enter Sandman, but Mr. Sandman, by one of those old songs. And before you know it, they're getting engaged, and they begin to sort of acquiesce to your exercise demands, as long as you are careful, especially with this generation, to make it seem like fun and purposeful. That generation is very much into only purposeful activity. Exercise was what people in Hollywood did, who were in movies. And there's a really interesting time, I think it's People magazine, of a couple of Hollywood stars from the 70s doing this new thing called jogging.
Jogging, the J silent, I think.
Well, so yeah, it's just all in how you package this for this generation.
Well, thank you, Bart. I appreciate that. And curious if you have anything to say about the pain and discomfort portion, since that's also a big barrier of what you do.
Well, sure. In addition to, of course, modalities that are really good, but, you know, distraction for pain. I mean, there's some pretty good indication that if you get the part of our brain busy, the part that notices pain, and get it to noticing something else, then it sort of forgets the pain. Yeah. So if you're having some of your pain that came about from your snowboarding days, just come downstairs and we'll play some Ride the Lightning.
Distract my well, it's getting personal.
I don't know. I wanted to come back to that. It's just so funny that you picked Metallica. I love Metallica. But so anyway, really, but that just goes to speak to really, even though it sounds silly, it speaks to the individuality that each of these folks have. It's so, you know, we want it to be sort of this cookbook approach, and generally it is, but each person has specific needs. It's going to be a bit different. You know, I can remember, in fact, a time when we had our AC/DC fan in the gym, and the lady who prefers, you know, Beethoven, and that was challenging to get them both, you know, pleased with the atmosphere. Well,
Thank you for your contributions, Bart. Glad you got the audio figured,
yeah,
so we could hear you. So we got a few more obstacles that are common And next one is feelings of loneliness or isolation. So especially in the wake of COVID, it's easy for people to feel lonely and depressed. Sparking conversations about how being more active might combat those feelings and encourage activities, and where in-person or online participation is done safely while they remain socially connected and safe. I mean, I think that one's pretty self-evident. Fixed income it can be a barrier, but it doesn't have to be the reason to avoid activity. There are many low or no cost activities such as walking, dancing, chair yoga, so hopefully we can find activities that don't require a lot of cash. I'm curious, what are some other common barriers that you encounter providing services or activities to folks in general or folks with dementia, and what solutions have you come up with?
I was just thinking, this is more of a solution than a barrier, but one thing I've seen our activity staff do a lot is letting participants take leadership. And I guess this might be more of a congregate setting type of activity, but letting them take leadership over the activities that they're doing. For example, we have a participant who runs a Bible group, and we've got a participant who leads a group talking about music. And so we have a lot of participant-led groups, and they also really motivate each other, and they get to share their own interests with everybody else.
Yeah, there's so many awesome things that I heard that I was feeling when you said that. But as it relates to the motivation, sometimes somebody's motivation isn't to be a passive person and attend somebody else's activity, but actually share their interests. And so that's a great idea. That might be the motivation of somebody who isn't willing to participate in your activity, but let me do my activity. Let me pick the game. Thank you for that idea. It's a great one. Any other ones come up?
Ann Lindsay said, as a barrier, transportation, and then commented that Redwood Coast Village can help with that.
Yeah, hopefully transportation is never a barrier if community support services are in place. Area 1 and Aging is a great place to go to for transportation solutions. There's also several programs for participants, are able to get transportation. Dial-a-ride's an option. Even sometimes taxi and Uber are appropriate for people. Maybe not somebody with moderate to advanced dementia without somebody who's there with them, but occasionally we got to get creative. Anything else come up?
Rhonda and I experienced one today while we were needing to take a look at somebody who had been falling in her home. And she met us at the door and basically told us to get lost, that she wanted nothing to do with whatever we had to offer. And somewhere in our conversation, she mentioned a piece of DME that she did not want in her house. And that was what we sort of cued in on to get her to allow us to come in, ostensibly to rid her house of this equipment, but really to see how she's doing walking around and kind of eyeball safety concerns otherwise. And it was kind of in simplest terms, it was letting her sort of be in charge of what was going on. Here's somebody who's losing control, physically, and probably at that point of feeling some loss with her mentation. And it sort of gave her some control over these couple of do-gooders at her door. But so that kind of, I don't know if you've mentioned this already, but that desire that they will of course have, as we all do, to have control over what's happening, especially as they begin to lose that control.
Well, thank you for sharing that. I heard a few different important things, first of which you had mentioned, being able to provide autonomy or feelings of control to people really help with their engagement. Also being able to adapt to different people's personalities. Not everybody's hard or easy to get along with, especially some folks have a really gruff surface, but with some small perseverance and and care, you can actually crack through and get them to actually engage with you and the things that are really the problem versus, them avoiding everything altogether. So thank you for sharing that.
We had
go ahead.
another comment regarding the barriers, hearing and vision, and I'm assuming that's vision loss, hearing and vision loss. So, yeah, sensory sort of barriers.
Yeah, sensory deficits are black and white barriers that hopefully we can find solutions for, easy as clean glasses or the correct prescription sometimes is what it takes. Sometimes hearing devices help, whether it's expensive hearing aids or this cheap stuff you can get off of Amazon. But knowing those sensory deficits and being able to adapt to them or provide adaptive equipment obviously helps folks overcome that as a barrier. But thank you very much for listing that as an important one. Any other ones? Alrighty. So offering activities to seniors is only one part of the equation. It's an important part. Equally important is their motivation to participate. Pretty sure that's what Luke Skywalker said at some point. Many older adults feel like there's no benefit to saying motivated or active and have an attitude of what's the use. Yet most older adults wish to remain independent and do not consider how inactivity contributes to various health conditions and preventing independence. Motivating older people to stay active and even exercise often means you may have your work cut out for you. With the many health challenges elderly people face, they can sometimes develop a mindset that is not easily swayed. And staying positive, patient, and kind when trying to motivate someone to be more active will go a long way. The health benefits are even greater if they begin early in the aging process. And understanding how to motivate seniors will help you to extend their quality of life. So how do we offer activities to people with differing and changing needs related to the cognitive decline? We just discussed the skills and traits that are important for activity leaders to be able to work effectively with people with cognitive deficits. Now let's take some time to discuss how to plan activities for people with dementia. First, it's important to understand the stages of dementia and the fundamentals in caring for someone with dementia. So we'll take a look at the stages and those fundamentals. With a better understanding of the dementia process and how to care for someone with dementia, we can be more effective in offering appropriate and engaging activities to people across the cognitive spectrum. So this is 7 stages of dementia. There's a few different scales, and this one is pretty easy to follow. People who have dementia tend to follow this pattern of cognitive decline. However, people can differ in the speed that their disease progresses. Some people's cognition may rapidly decline while others may not. People will also have a varying capability day to day and even hour to hour. In the morning, someone may have greater clarity while later in the day, they may have increase in confusion. It's important to have an understanding about where someone tends to fall into this scale in order to adapt to their varying capability and needs. So, I want to talk about 7 fundamentals of effective dementia care. And this is just, I think these are important fundamentals for anybody who is around people with dementia, whether you're working for them or not. It's important to remember that people with dementia are still able to experience joy, comfort, meaning, and growth in their lives. That their quality of life depends on the quality of their relationships that they have with others. And I underline relationships and community a few times in the next few slides because it's important. Optimal care occurs within a social environment that supports the development of healthy relationships. Again, there's that word. Good dementia care involves assessment of a person's abilities, care planning and provision of activities, strategies for addressing behavioral and communication changes, and an environment that fosters community. Each person with dementia is unique, having a different constellation of abilities and needs for support, which change over time as the disease progresses. Determine how best to serve each person by knowing as much as possible about each person's life story, preferences, and abilities. This slide's super important in my opinion. And good dementia care involves using information about a person to develop person-centered strategies which are designed to ensure that services are tailored to each individual's circumstances. So in addition to the 7 fundamentals as a baseline for working with somebody or caring for somebody with dementia, these are some very important things to know. Cognitive, physical health, what are their ranges? Because we're not talking about somebody is the same every single day, but what is their range of cognitive health? What's their range of physical health? And the same thing could be said for their physical functioning. And all this is to know kind of what their capabilities are as well as their limitations. What's their behavioral status? Do they have any maladaptive behaviors? And if so, do you know the antecedents or the triggers so that you can hopefully avoid those? Do you have a plan of care in place if they do occur to help de-escalate the situation? We talked about this previously, but what are their sensory capabilities? What's their vision, hearing? What things do we need to know so that we can help allow them to participate more fully? What's their decision-making capacity? Are they their own person, or do they have somebody that makes decisions for them? What's their communication ability? Do they have verbal communication? If so, is it alert and oriented? If they're nonverbal, do they have any other methods of being able to communicate? We talked a bit about this earlier as well. These last 3 are also super important to understand. What's their personal background, their cultural preferences, and their spiritual needs, as well as preferences for those, so that we can offer those things, but also not do anything that might be contrary to their thought system. I'm curious, these are some important things to know. Did I miss anything? Does anybody have any other items that you think should be on this list?
There is a comment, just confirming I'm unmuted. You also need to know about their family and close supporters. Do they have advanced directives?
Thank you for sharing those.
Pre-morbid personality traits. So I'm guessing this is like prior to their diagnosis or cognitive deficit or decline. What was their personality like before?
That's an important thing. We're actually going to talk about some of that, assessing somebody throughout their entire lifespan, not just where they're currently at. Thank you for that. Any other comments?
I was also thinking any current life transitions or major changes they're going through. Often that could be loss, or we see a lot like changes, moving, housing, yeah, just major life transitions.
All right, well, thank you for that.
And we have another comment, triggers.
Triggers, yes. Yes, it's good to know that if somebody has a maladaptive behavior that's related to loud noises, let's avoid the loud noises, that kind of stuff. So
probably
right.
under I've been unsure if I should highlight this or not, but it's a little bit different. It's how it is under their behavioral status, but how receptive they tend to be to what's being offered.
Yeah, I think we're speaking to the fact that in the provision of care, some folks sometimes aren't forthright in being honest about information. They might tell you something that you want to hear versus, what the truth actually is. There's all sorts of different facets of having accurate communication, but gleaning that stuff is sometimes tricky with somebody who's not going to be forthright with their providers.
Which is why communication among caregivers, staff, and ancillary providers is extremely important.
Yep. Thank you.
Yep.
So if you live in the activities like professional domain, you probably do assessments at some point. We're not going to spend long on this, but there are some standard assessments that are used in hospitals, skilled nursing, day centers, and other venues that provide therapeutic activities. This is a Briggs assessment. Another standard assessment is this idle arbor leisure battery that includes a leisure interest measure and a bunch of other stuff. It shows how clinical this could get as far as how do we provide recreation to somebody, and all of a sudden it looks really clinical. But it's important. This stuff is there for a reason. And the purpose of either of these forms or other assessments are try to learn about the person's capabilities and interests so that we can create a care plan that includes goals to offer meaningful activities. Whether or not you need to use an assessment tool is up to your role. Sometimes they help to effectively create and plan recreation socialization opportunities. But ultimately, you don't need those things. All you need to know is something about the person and their story and their lifespan that we just talked about. It's good to know about somebody's background so that we can know their interests. One of those ways that I'm fond of doing is a life story. And you may not, again, you don't need to do a clinical type assessment in your role. More importantly, you don't need to complete one of these assessments to learn about somebody. To be able to engage and motivate or to offer fun and engaging activities, all you need to know is that person. And so for the purposes of the life story, it's ultimately an interview process where you get to know about their narrative story, about how their life events have shaped their story and provide insights in what they're currently enjoy doing. For a person being interviewed, it's an opportunity to share a part of themselves and feel like their life experiences have validity. People often want to talk about their lives, but they're rarely asked. When somebody takes the time to listen, the message is that who the person is, what they've done, and the things that they care about are important. If you can add pictures to their story, the visual reference of the story makes it even more powerful. When you're doing a life interview, it's helpful to have some prepared questions. There's some examples on the screen. There's also a website called thelegacyproject.org. Again, I don't have any affiliation with them, but I have used them in the past, and I find that their tools are free, firstly, but secondly, very useful in helping to develop life stories. So here's some questions that you can use to help direct a life story. It could be as simple as writing them down in a scrapbook and taping on some pictures that you have. You can put into a PowerPoint. There's free templates online. Again, that legacyproject.org has multiple templates that you can use. I'm curious if anybody on the call has any experience doing an actual life story and if they would care to share that experience. If you could come off mute, that'd be super cool.
Was this some kind of formal thing that I am unaware of?
No, I mean, life story is not a new thing. It's not a formal thing. It's been around.
I need to pay more attention.
Well, if you don't, please look into it. It's one of the coolest tools, and that's one of the purposes of this presentation for the folks in the call. If you haven't heard about this is a cool thing.
Yeah.
Another cool, like a life story, shadow boxes are another great way to visually tell a story about who a person is, what's important to them, and other information that's helpful in activities planning. For people living with dementia, it can be difficult to retain a sense of identity and to remember important moments from the past. Creating shadow boxes to house warm memories can help recall events and people. These memories can stimulate prompting conversation with family and friends. In senior living settings, shadow boxes can also help people find and identify their apartments. Finding one way is an essential ability and a prerequisite for autonomy and independence, reinforcing self-sufficiency and self-esteem. So shadow boxes are pretty cool. Ultimately, it tells a picture of a person in a visual form with things that are important to them. So once we're able to learn about someone, then we can start offering options for recreation. Here are some tips for choosing the right activities. Relate activities to their work life or interests. A former office worker might enjoy activities that involve organizing, like putting coins in a holder, helping to assemble a mailing, or making a to-do list. A former farmer or gardener may take pleasure in working in the yard. Avoid overstimulation. Try not to overstimulate the person with dementia. Be selective with outings. Avoid crowds, constant movement, and noise, which many people with dementia find overwhelming. Activities include more than just planned activities. It's also important to understand that activities are not just planned activities. Activities can include life skills, which means participating in daily living skills. They're encouraged to help hold their toothbrush or washcloth, or to choose an item of clothing. This could also include mealtime activities. They could be encouraged to fold the napkins, set the table, clear the table, or wash the dishes. Also, allowing them to help with watering plants, dusting, or folding the laundry are all activities and just as important as a game of bingo. Choose activities that hit the sweet spot, that aren't too easy and aren't too hard. If an activity is too simplistic or childish, the person might feel insulted or bored. If it requires remembering sequences or is otherwise above the person's cognitive level, it may frustrate or turn them off. Tap into memories of past events. For many people with dementia, a sense of movement and rhythm is often retained. Listening to music, dancing, or contact with babies, children, or animals provide positive feelings. People with dementia often have excellent memories of past events, and looking through old photos, memorabilia, and books can help the person to recall earlier times. The opportunity to relive treasured moments can be deeply satisfying. If reading skills have deteriorated, make recordings for them, locate picture books and magazines in the person's area of interest. Definitely continue to go on outings as long as you and the patient or the person are comfortable with them. People in the early stages of Alzheimer's disease may still enjoy going out to places they enjoyed in the past. For example, the person might enjoy going to a favorite restaurant, park, shopping mall, swimming pool, museum, or theater. Keep going on these outings as long as you are comfortable with them. And focus on enjoyment rather than achievement. Find activities that build on remaining skills and talents. A professional artist might become frustrated over the declining quality of work, but an amateur might enjoy a new opportunity for self-expression. Keep in mind that it's about engagement, not about the outcome or achievements. Lose your preconceived notions of how the activity should be done or what is the end product might be, as people in the middle and late stage of dementia are not capable of understanding the goal of an activity. Just enjoy the process and the current moment of doing. We're going to take a look at some activities, just some ideas for best practices, and we'll see what else folks have. For dementia patients with limited mobility, try chair exercises. Can dance to music from their generation. We talked about these things already. Taking a walk, it's one of the easiest ways. Try to find a place that is sunny and comfortable. Maybe the shopping mall if the weather is inclement. Slow marching is good for exercise and balance. Try water exercise, restorative yoga. Any movement or stretching exercises is wonderful, especially swimming is one of the most miraculous things I hear for folks who are elderly. So around the home, we're talking about games, puzzles. Listen to music, a universally soothing activity. Listening to music from the past will help them remember the good times associated with the music. Not sure how music ties into the memory, just think, do you remember how you learned the alphabet? It's one of the first songs we all learn. Some other sensory activities could include sorting and matching up nuts and bolts or tightening screws. You can create a memory bag, which is essentially a bag with stuff that might be scented or might have other things that would help with reminiscence. Help with clean around the home, help with cleanup around the home and preparing food. Vocational activities are both super important. And there's some other ideas here as well. But having games in general up to the highest capability is important to keep the cognition activities going. Sensory activities are folks that are more along the moderate to advanced scale of dementia. Some of these things can be sensory beanbags with different textures, incorporating art and music in the daily routine. Simple crafts, knitting or painting can be relaxing. A fidget box is important to have if folks get anxious. Everybody enjoys spa time, so most people really enjoy soothing, calm environments as well as being pampered. Baked cookies, the smell of cookies alone is something that's pretty amazing. The idea of creating a virtual beach, I don't know about that. I put it down because somebody felt it was a pretty good idea. But the idea is that you can create false environments in a safe setting, and it has a similar impact on well-being for somebody with advanced dementia. They might just think they're at the beach. Some other social and emotional activities, create a mystery bag. You can Google that if you don't know what it is. It's also called a stereognostic bag. Ultimately, it's a bunch of shapes and cubes, and it helps initiate play and conversation. Playing with dolls can help fulfill needs for comfort and attachment. There's some mixed feelings about this historically, but the literature shows that comfort dolls and comfort pets, which are not actually alive, provide some very real benefits to folks who have anxieties. Relax and reminisce about the past. The older memories generally stay longer than newer memories, so folks might be able to tell stories of their childhood or early adulthood in much more meaningful ways than more recent events. Singing can help build connections with others. We've heard singing and music multiple times, and some other ideas for social emotional activities. Outdoor activities, here's several ideas, won't go over all of them. But ultimately, getting outside is super valuable. Just regardless of what you do, sunshine and fresh air is universally beneficial to a human being. We have a wonderful, accessible zoo here. We also have very windy days that very easy to fly a kite. Those are two of my favorite things. Well, I'd like to end the presentation by asking, what other activity ideas do you have? Really, that's sometimes where the best information comes from, is just ripping other people's ideas off. So please share your ideas.
I like bringing my guitar and doing sing-alongs.
Wonderful. I'm curious, what music do you pick when you do sing-alongs? Just like American Standard Storybook or Songbook?
Depends on the predominant age of the group, but I've learned some songs from the 30s and 40s, I have a repertoire of early rock and roll that works for a lot of people in their 80s. And you know, some 60s music also is in some people's repertoires.
Wonderful. Thank you for sharing.
And folk music, American traditionals.
Bart said drumming, and Lily said reminiscence books.
Well, we are already 1 minute over 3 o'clock, and I believe this is supposed to end at 3. So I appreciate everyone's time. I'm going to stop sharing. And I do have this deck available, which has all of my resources, if anyone's interested.
All right, well,
Otherwise, thank you very much for your time today. I really appreciate the opportunity to present to you guys.
thank you, Dave. Appreciate that. And thank you all for joining us. And just stay tuned for our next presentation. And then I'll also be sending out information about the dementia conference in October this year, which I'm really excited about. We have some really cool topics. So yeah, thank you all for joining.
Bye-bye.